Welcome to the Strong Starts podcast with your hosts, Jessica Whitehead and Sarah Gerber-Kai.
Hey guys, welcome back. So Jessica recently had the opportunity to present at the Council for Exceptional Children convention in Salt Lake City. And Jessica, you came back with all sorts of ideas and very inspired. So we'll probably be hearing a few of those different ideas and topics over the course of the next few episodes. But you had one thing in particular you wanted to talk about today. What did you want to kick us off with?
I was fortunate enough to be able to attend Dr. Nikki Elliott's presentation on embodied inclusion. And one aspect of that presentation that really stood out to me was when she discussed a fragmented model of care. So when you think about fragmented model of care, think about doing a puzzle. Like in COVID, my daughter and I would sit down and do these complicated puzzles, which in hindsight was more stressful than calming. But I think about trying to find these pieces. And when her and I would sit together and we work on the puzzle, we made a lot more progress than if I was in the kitchen cooking and she was working on the puzzle alone. And I think about that with the kids we work with. We really are breaking them into pieces when we sit down and we break up their care into these silos.
Yes. Yeah. Because like you think about the puzzle, if I have all the corner pieces, it's going to do me no good. Yes, to be like in another room of the house trying to describe out loud, oh yeah, these are the pieces I have. This one has a flower on it. This one has a house on it. Okay, can you guys figure out where they go? Like versus everybody actually getting together and being at one table. And you're right. In education, this is often how it works. So for those of you who aren't familiar, like if a student has an individualized education plan, an IEP, there's often a big team that is working with a student. There's lots of different service providers providing different types of services to address certain needs that have been, decided upon by the team. But a lot of those decisions, like the minute decisions about what it is that's taught and how it's taught, those often happen, yes, in our silos. Like we're alone in our offices and we're working, even when we're working with the student, collaborating with them, we're making those decisions and we don't get those opportunities to collaborate. And it does we end up running into a lot of issues with that. And so I do like this idea of a more holistic care. Jessica, have you had experiences? You don't have to give any details about, specific students you've worked with or anything like that, but where you've seen kind of this breaking up into pieces happen, and what does that end up looking like?
Dr. Nikki Elliott also gives an example of this, which I think is a great example because it's very common. It's a common thing that I've seen. If you're a parent out there, you've probably identified with this, where we have a student who's maybe very anxious during the day. And we haven't really identified the anxiety piece yet, right? So what we see, instead of seeing anxiety, what we're seeing is, okay, an upset tummy. And the student has frequent visits to the nurse. And so then we want to see a doctor. My kid's stomach is constantly upset. We have to see a doctor. Then we get referred to a gastroenterologist for these stomach issues.
Mm-hmm.
At the same time, we're seeing these problem behaviors play out at school. Not only is their stomach hurting, but then they swipe a paper on the floor. Maybe they elope out of the room. They're slamming their pencil down when there's a difficult assignment. And so then now we call in a BCBA or someone to support the behavior. And so then we're working on maybe assessing the behavior, developing behavior interventions. And at the same time, we're worried about how she is writing, maybe. So we say, oh, she's in kindergarten and writing is frustrational. And I see that her pencil grip isn't always consistent. We're going to consult with an occupational therapist about that. And so then her parents are starting to worry about all these behaviors and all these things. So they take her to an outside service for play therapy or group therapy. And so we have all these independent service providers treating all these independent symptoms. And are we really getting to the root of the problem that is, the underlying issue?
Yeah. Yeah. And, who have we communicated with along the way? Who ends up at that table for those conversations? If you're wondering hey, what do I do about it? We're going to go a little bit into some ways to create some meaningful collaboration, and look at children more holistically. But you bring up an important point about some of the things that we end up seeing as a result. And one of the things that you talked about was behavior. And this is like one of the hardest challenges for me personally. The one I struggle with the most is when we see a child communicating like, "Hey, I'm confused," or "Hey, like you haven't actually figured out what it is that I need," or whatever it is that they're communicating, because we've all worked in our separate offices through these behaviors that end up getting also addressed separately. Or even worse, this student is receiving all sorts of discipline for these behaviors, or, God forbid, ending up in a more restrictive level of care of an educational setting due to those behaviors, because they're trying to communicate, "Hey, this isn't working." The one that's toughest for me is when it's, "Hey, I'm confused because you've taught me how to do this 3 different ways," but our children don't recognize that that's what's happening, because that's not their job to recognize it, and are communicating it through their behavior.
I think about our own medical needs as humans. It is very common that we go to one doctor and they refer us out. And now the way insurance works, a lot of times we have to go to our primary care physician and they refer us to where we need. And so
Mhm.
then we're in this like loop, right? Well, you're going to
Yeah.
go here and then you're going to get some treatment. You're going to come back. We'll see how it goes. We'll go here, get some treatment, come back. I've never, had doctors all sit at a table together. Hey, we have this one patient, let's all get together. And so sometimes it can be very frustrating. I think of as an adult, there's issues I've had. You're sending me here, you're sending me here, you're sending me here. And I'm tired of going to all these doctor's appointments just to try to find, what's happening. And, you think about that at the child level in schools. And that could be, I'm sure that's so frustrating.
Well, and that's probably one of the biggest barriers, is simply, and um I'm not a medical professional, but in like the little bit I know there are some medical professionals that advocate for exactly what you're talking about, Jessica. Like, we need all the specialists at the table, especially when there's complex cases, and some do have like the structures and systems to be able to do that. But you're right, it's like not a normal, typical thing that happens. But that does seem to be one of the biggest barriers, is simply having the time for us to all get together in the same room and talk about what's going on with a student.
Well, so let's talk about this process a little bit, because I know there's probably BCBAs out there that may not be in schools and parents that maybe are unfamiliar about the process in schools. We can speak a little bit to the process of discovery in schools. So, and this I would say is a little more prevalent in the younger grades. It does happen in the older grades, but typically we get these students who haven't been diagnosed in the younger grades. They come into us, we kind of give them time to be in school and we see an issue. Okay. So all of a sudden, this student is in the classroom and we're seeing more and more pushing papers on the floor, pushing chairs back, yelling, eloping, all these things. So what happens? They don't just go immediately to an IEP. And this isn't set in stone. So if you're a legal person out there, don't come after me. I'm just saying that one of the ways we go through the process, I know there's multiple, I know there's all these cases, but I have a student in mind when I'm talking about this. So typically, the first thing we'll do is some sort of intervention or some sort of digging into this. The student is having this issue. Is there something we can do before we get to the level of evaluation? So it is not ideal to just, oh, there's a problem, let's evaluate it. Think of like when you do reading intervention. You see that there's a problem that a student is having in reading, and so you try to intervene before you just say the student has a reading disability. It's similar when we're talking about social emotional, we're talking about behavior, we're talking about speech language, all those things. We will try to do some things before we get to that level. And then there's some sort of like intervention team meetings, whatever you want to call it. Different schools call it different things, but there's a team of experts that get together to talk about these interventions, talk about the progress that's being made, not made. And then after different levels of that team meeting, we increase interventions. We've tried this, we've tried this. Now it's time to talk about the possibility of evaluating the student for special education. And that's the fast version. What we do when we go to evaluate a student, then we sit there and we say, okay, what areas should we evaluate? And that's where this piece starts happening with the different experts at the table. So now we're bringing in who's going to evaluate this. Okay, so we're going to have speech evaluate this, and then they make this goal. OT evaluates this and then creates this goal for the IEP. We have the special education teacher making this goal for academics. So now after evaluation, we're starting to break these up into different goals with different experts, different service providers.
Yeah. And who decides, how is it decided, who gets invited, who gets involved?
See, that's where it's tricky. So
Yeah.
we just had a student that we had a referral meeting. So we're sitting down at the table to decide what we're gonna evaluate the student with. How we decide who gets there is based on some data, right? We have data to show that the student is struggling with behavior. So I'm brought to the table as the BCBA. But now here's the tricky part. Okay, the poor speech language path. I tend to invite her to probably way too many things, but there's so much about something like language that isn't seen. So people think, okay, language is articulation. That's speech, but language can actually be things like how the receptive language, how they're taking in language, how they're processing that language, and their expressive language, how they're able to communicate that to others. And sometimes that is a piece that can cause behavior. They're struggling to take in this language, they're frustrated, or they have a difficulty expressing, what they want to say. And that's something that I think people don't always see. And so sometimes that is skipped. So we might not think, oh, that kid talks fine, so we don't need to invite speech language. That is a muddy piece. And then we think of OT. Well, OT is not just holding a pencil. There's a lot about OT. There's more to OT, and there's some sensory needs. And sometimes we don't always know the sensory needs, or we don't know they have sensory needs. So we might not bring OT to the table. And that's where some waters, I think, get muddied.
Yeah. Well, and this is what one of the things that makes you so amazing, Jessica, is because you I know all the stuff that goes into the background of you constantly learning about behavior and about children and how we show up and what kind of how brains work and all the sorts of things that you have to learn in order to be able to something to go off in your head to be able to say, you know what, I should probably invite speech and language. But the other part about who gets invited to the table is if a child has outside providers, it gets a little complicated. I know folks do this a little bit differently. I know some folks also, the barriers simply like big meetings with 20 people around the table can be pretty intimidating. I get it. I've been there. I get it. But outside providers, are they getting invited? And depending on what's been discussed before, they might not be unless the legal guardian explicitly invites them. Are all caregivers invited? This is something that I've run into a lot with elementary, but then also middle and high school students who, for one reason or another, aren't living with their parents or caregiver, like their legal guardian. They're living with, an auntie or an uncle or somebody just, maybe the family needs a break type of a thing. Well, is the person who's taking care of them primarily the one who's at the table? Because schools are only inviting legal guardians. So it does get muddy. But I only mention the thing about why I'm so impressed that you do the research and have the knowledge to be able to know to invite somebody. But are there any other barriers, I guess, to just what is the harm in just inviting a speech path? Why wouldn't you? If there's any issues, because we know behavior is communication. We know that there could be other communication things going on. Why wouldn't you just invite them?
Well, and I know we're going to get to more of the solutions in the second part. So for this, when we talk about barriers, especially in education, we're talking about time, money, and people, right? And often resources. and people can be a resource. So I think of all the meetings we have. If I invited the speech path that I talked to every single meeting and she went, she would probably not be able to provide speech services, and she'd probably maybe file a harassment charge against me as well. Uh, but with that, it doesn't mean conversations have to stop. So when we think about barriers, one is, okay, if I have an outside service provider, there's been a couple barriers to getting that information. One, they usually can't come to the table. However, some will. Like a lot of times we have a program where parents see an outside counselor, and that counselor is contracted with our district and will be able to attend. So that is different. We also have instances where parents don't want to disclose outside services, and that actually happens more than you would think. There is still also a stigma around mental health and wanting or not wanting our child to be diagnosed. So sometimes there are things that are not disclosed to us on purpose. Sometimes it's also not purpose. Sometimes this kid's getting so many things and the parent forgets. Like, I'm a mom.
Yeah.
It's hard to keep track of sometimes when you have so many things going on for your kid. You have multiple children and you're trying to keep track of everything for every child. So that is difficult as well, is getting the information from everybody. I send out a lot of questions, a lot of behavior interviews, and the behavior interviews also talk about what else is going on with a kid besides just behavior. Again, my barrier is what's being disclosed to me. The other barrier is how well do we know the student? So we have a lot of experts coming to the table who don't know the student. So if I'm being brought in, again, I'm getting the information that's provided to me. And then I have to figure out, so I have to take the time. I have to try to get to know the student. I have to get into classrooms. I have to talk to people. And again, time. And sometimes the barrier can also be the student. Some students are difficult to get to know. Sometimes it's very complex, and the complexity alone is a barrier. There's a lot going on there. There's another really big barrier out there, and it's disagreement. So there's a lot of times where we'll talk and there's a disagreement between people involved with the student on what's happening. And that could be me to a parent. This happened recently where, talking to a parent, this is kind of where we're at as a school or as a team, and this is what the parent is viewing needs to happen. Or I view this expert views this. Sarah and I have had conversations before where I had this perspective and she has this perspective. And we can talk about data all we want, but there still can be a difference in how people are interpreting that data and viewing what the root cause is.
Oh, yeah. There's that very human element. That is probably what this all comes down to, honestly, is a very human element. And yes, that is influenced largely by money and time and people, because I can't count the number of times where the root of the disagreement was, hey, if we agree on this thing, then it's going to lead to X, Y, and Z services, and we can't afford those. So very real, the disagreement. However, what ends up happening for the student on the other side of all of that, of all those adults and all that humanness and that realness, is that not just the behavior and frustration, but we end up seeing major loss of learning opportunity. I mean, those services that are being provided were I hate that this is the only word I can come up with. We're doing a disservice to those service providers because they're operating in their silos, their offices alone, and they're not seeing the goal progress for their students, because those skills aren't translating. They aren't transferring across settings. We're not reaching our goals. We're ending up recommending things like more SDI, more instructional minutes, service minutes, and more restrictive placements, which is also time, money, people, resources, because we aren't seeing the progress that we expect to see, because we haven't been able to meaningfully collaborate and have all the people at the table to have those conversations. So I just want to put that out there. Yes, everybody, like, I get it. This is very human. This happens. It's not just in education. This happens everywhere, that there's disagreement amongst teams, and we end up with maybe like less than preferable outcomes. But the way that this ends up playing out can be pretty extreme for some students.
Yeah. So I want to break up, as I know we're getting toward the end of this part one, and I want to break up a school day, kind of the life of a student, to put this in perspective. So if we have a 7-hour school day, hypothetically, that is not 7 hours of instruction. And you take out lunch and recess, and it even looks different in secondary. So primary and elementary, you think about that as like a 5-hour day in the classroom, and we're not including like specialist time, right? We're taking out specialists, we're taking out recess, we're taking out lunch. And then secondary, say there's a 7-period day, and then 2 periods are elective. So we have five other periods, and however you want to break it down. So then the student gets taken out. I have an IEP pulled up right here. And this student gets 30 minutes a day for this, 30 minutes a day for this, 30 minutes a day for this, and 30 minutes a day for this. Multiple goals. That's 2 hours right now on services that are pull out for this student. So now we went from 5 hours in the classroom to 3. Okay. And then after school, the student also goes to speech or outside OT. And then, on top of it, if they're in secondary, probably sometimes elementary, they might have homework. Don't get me started on the whole homework thing, but they might have homework even though they shouldn't. But they'll have homework. I probably should take that out. Otherwise I'm going to get canceled.
Nope, we're keeping it in.
They have homework. And then on top of that, maybe they're in a sport, right? So this student's day is greatly impacted by pull-out services. And I'm not saying that they're not warranted or they shouldn't happen, but we're operating in these silos, and each silo is taking a piece of the student's day, and that's a big deal. So it's a big deal that when we do this, we also have to be aware of what we're doing to the student during this day. And I think of students, so this one student's IEP that I have pulled up, greatly struggles with transitions. Transitions are one of the biggest problems, and schedule changes. That's a big deal. So the student's a very black and white thinker, very structured, relies on routine. But also his day is built with tons of transitions because he has a lot of needs. So we have these needs, and then we're trying to balance. Yeah, he has these needs. We have to service them. He doesn't like transitions. How can we build that in? And also his day is long and heavy with services and academics.
And on that note, with that visual in mind, we're going to end part 1 of this podcast. Please join us for our next episode, part 2, where we're going to go into some meaningful strategies for collaboration. And like and subscribe wherever you get your podcasts, and follow us on social media. We are at Strong Starts Podcast on Facebook, Instagram, TikTok, and YouTube. Bye, everybody.